Hi, I'm Dr. Larry Wyatt. Welcome to Radiology Grand Rounds.
Hello everyone, this is Dr. Larry Wyatt with Radiology Grand Rounds. Start our case today with, or start our session today with a case of a 57-year-old female who presents with chronic low back pain. She is neurologically intact and her vital signs are normal, and she has no signs of any organic disease. We see here a lateral view of the lumbar spine depicting L1 through L5 and the top of the sacrum. The hallmark radiographic findings in this case are those of an arthritis. If you'll notice closely, at the L2, L3 level, there is severe loss of disc space height, a great deal of sclerosis along the end plates of both the inferior portion of L2 and the superior portion of L3. There are small osteophytes projecting from the anterior inferior corner of L2 and the anterior superior corner of L3, along with small osteophytes projecting from the posterior inferior aspect of L2 and, to a somewhat lesser extent, from the posterior superior aspect of L3. In addition, and finally, there is a horizontally oriented vacuum phenomenon within the disc space at this level. Similar but less severe changes are seen at the L1, L2 level, absent the vacuum phenomena and posterior osteophyte formation. The intervertebral foramen at the L2, L3 level is narrowed, obviously, by these posterior osteophytes, which should lead you to a search for compressive neuropathy, compressive radiculopathy, although in this instance the patient is neurologically intact. These changes at this level are classic for a condition known as intervertebral osteochondrosis. This is a condition where the nucleus of the disc is dehydrated substantially, and because of the dehydration of the nucleus, the patient develops this form of degenerative joint disease. This was coined by Don Resnick and Jin Nawayama out in San Diego, and this is a very common condition in the lumbar and cervical as well as the thoracic spines. In addition, at the L3, L4 level, below the level of the intervertebral osteochondrosis, this patient also has a very large defect in the anterior superior corner of L4 with a small, well-corticated bony fragment identified at that level. This is very classic for an old Schmorl's node that happened when this patient was much, much younger. In addition to these radiographic findings that are seen in the spine, there is also some vertically oriented patchy calcification identified within some prevertebral structures anterior to the spine here. The posterior portion of it's quite linear and well defined, and the anterior portion is less well defined, but there's an overlap of a large pocket of large bowel gas here. This is also another classic radiographic finding for calcification within the abdominal aorta and its tributaries. At this level, we're likely in the common iliac vessels, but there's no sign of aneurysm, and that's critically important. So that's our case for today. Intervertebral osteochondrosis at the L2, L3 level, as identified here. A very large Schmorl's node at the L4 level. That's residual from something when this patient was much younger. And calcification within likely the abdominal aorta and definitively within the common iliac vessels. That's it for Radiology Grand Rounds this week. Have a great day.